Welcome back, everybody, to the Dental Injector Society Podcast. I'm your host, Anna Delgado, and I am thrilled to have one of our very own national trainers, Dr. Shawn Cabbell, with us.
That's right.
Howard University and Maryland alum. He brings a very dynamic background, not just in dentistry, but also in marketing. He has a blend of clinical skills and tremendous of business, and he's been a tremendous part of our faculty at DentaSpa. He currently practices between Indianapolis and the Virgin Islands, lucky him. But he's owned 5 practices, and so he has that background that not all dentists have in both the clinical aspects and both running a business. So I'm excited to have him here today at DentaSpa. He's been such a contributor over the years, not just in teaching, but also just really helping with mastering techniques and always bringing in innovation. Dr. Cabbell is one of our instructors that always has something new and exciting to share beyond the education that we have, whether it's tech. And so it's exciting to have him here to share a lot about his journey. So let's get started. So you're an alumna, like we said, of Howard University. What a historic institution, also Maryland. Tell us about your experience and your journey going from those places to where you are today. I know that's only a small journey because you're so young, right?
Right. It's the Botox, right? Yeah. Howard was an amazing experience. I think most people that were able to attend Howard would say the same thing, that it was really a great experience. I have lots of friends, colleagues. It's opened lots of opportunities. Going to Howard University helped not only teach me, business. I was a business major, marketing major in School of Business, but it also helped me to understand a little bit about myself, about culture, about the world. I was at Howard in the late 90s. So around that time, there was
you aged yourself. I had everybody thinking you were 20.
So around that time,
how many years have you been practicing dentistry?
I have been practicing dentistry for almost 23 years. 23 years. Wow. Yeah. I have to think about that every time when someone says it. It still feels like it's only been 5, but yeah, it's been a while. I've had lots of experiences, learned quite a bit. I'm just able, like you said, to have multiple practices, different types of practices in different parts of the city and work in different parts of the world. So it's been a great experience. And I think, going back to Howard, that coming from that background, it helped me to open my horizons, to think about things differently. When I left Indianapolis, I obviously from high school, I had never lived anywhere else and never really thought about anything else. I didn't know Black professionals. I didn't know anything about dentistry or anything like that. So above all, that was really where I got the idea to become a dentist. I was dating someone who was interested in something in healthcare. And after dinner one time, we went to something that she had to go to help prepare her for school. But I just went along and I started listening to the things they were talking about. And that's when I kind of got the idea. Someone asked me, they said, "So what are you going to do when you graduate?" And I said, "Well, I'm a business major. I'm not doing any of this doctor stuff." And they were like, "Well, why not? Don't you, like helping people? And are you interested in science? Do you like science? You said you're a business major, so maybe you want to be an entrepreneur. Well, you should think about dentistry." And that's really where it started. After that, someone put that seed in my head and I started thinking about dentistry from there. And I was the only person, obviously, in my class that went to dental school, because the School of Business, most people either went to business school, went to pursue an MBA, started to work. A few people went to law school. AJ went to work on 106 and Park. That was the other thing at Howard. So many people that I met, went to school with and lived with, Ta-Nehisi Coates, all these people that became later mayors and senators and things like that, along with doctors, lawyers, and things like that. So the Howard experience was great for me. And then Maryland was also great. Maryland was the first dental school. And so there was the history of dentistry from the University of Maryland, still on the East Coast. So I was able to stay in touch with my friends and my Howard family. going back and forth between Baltimore and Washington, D.C. So, I have a special the DMV has a special place in my heart. I feel like, that's like a second home for me. So yeah, all of those things kind of led me to where I am. And I'm in Indianapolis, but I feel like I'm back and forth between, here, Miami, of course, the Virgin Islands, and, of course, because of DentaSpa seminars, we're able to travel all over the country. And, like we were just talking about this, how, with the courses, for example, in New York, that I kind of feel like I know New York, like that office, we share that office is a great office, the same patients, you get to see some of the same people. So all of these things have kind of led me to where I am now. And, I'm really happy with my career choices and the way the practice is and things like that.
Who you know, right? What is it?
It is who you know, where you live, what you do.
And is that the slogan from Howard? Who you know, or
It's HU, and then HU people say,
who you know, like
it's
that?
know who you know. It's See, you're not from Howard, so you wouldn't know that.
Oh,
I
see,
can't teach you the Howard secrets.
okay, okay. Well, we're very excited. I thought I was saying something cool here. I thought I learned it.
Okay, let's do it. So I say HU, and then you say
Okay,
All right, so HU.
you know.
Okay, there you
All
go.
right, there we go. Well, we're excited. We're excited to be coming to DC. We've done courses now for 15 years, and this is I think we've gone to DC once, but not for a full, not for like our level 1 program. So we're very excited to go there. We have a lot of alumni from Maryland and DC, so it's finally nice to go there, and not only serve the communities of dentists currently practicing, but we're hoping to work. We've been in communications with Howard University to see how we can help some of the 4th-year students and some of the alumni there have an opportunity to attend the course too. So thank you, Dr. Cabbell, for connecting me with some of those contacts.
I want to give a shout out to Dr. Long, Richard Long, HU alum. We worked together in the Virgin Islands. So he helped because I didn't go to the dental school at Howard. I don't have as many connections. I'm still part of the family, and I still, want to help students and help, everyone in general with a lot of the things that we're doing. But I just want to give a shout out to Richard Long as well.
Awesome. Yeah. Thank you, Dr. Long. I know him as well. So yeah, he put me in touch with somebody. And so we're seeing, we're so happy that we can offer the school, not just the actual 4th-year students, but also just anybody that would want to come associated with Howard. So we have a HU, code for that. But for new grads, so for the new grads that might be listening in, what advice would you give them, knowing that we're coming right there to their backyard if they haven't left?
Well, for new grads and anyone obviously in the area, the first thing is that I can't say enough about getting more exposure to new things, especially from people that care about teaching and want to help you out. Just like you were saying, it's all about who you know, contacts you make, and things you learn. And in general, all dentists from whatever dental school, wherever you're from, the things that we're talking about and teaching with hyaluronic acid and botulinum toxin they're not taught in most dental schools. I think there's a few that are starting to. And this is starting to become something that it really should be part of the armamentarium that we're doing, whether you want to do it therapeutic, cosmetic. It's a big thing. Aesthetics and dentistry is very, very popular. And so my advice is to soak up this knowledge, soak up making the contacts with people that want to help you out and teach some of these things. So, of course, we all know implants are really big. Learning more about ortho. When I finished dental school way back then, Invisalign was new. And so that was something that mostly the orthodontists were doing, a few general dentists were getting into, but things like implants, ortho, Botox, they're really big for the practice right now. So when you graduate from dental school and you have a base, you have an understanding of pretty much what's going on and what you can do, then there's still probably, 10 steps more of things to learn so that you can really get on the level of what's going on in modern dentistry.
Well, it's continuous. It's continuous, that whole learning. So,
exactly.
And that's one thing that most of our faculty are amazing at, is they themselves go around the world even to continue education, you with your plastic surgery program that you took as you were delving into the world of injectables. Um, but tell us a little bit about what got you initially excited about injectables and a little bit about your journey into that world and how long it's been now, because it's been quite a while.
Okay. It's well, I honestly it started from a recommendation from a friend. One of my close friends, Dr. Shawn Latier. He practices in Atlanta, Comfort Smiles, Atlanta. Shout out to Dr. Latier. And he told me, he said, did you know that there are dentists that are injecting filler in lip and in the lips? And at this time, I had never heard of that. I thought this was something that plastic surgeons did. And he
What
showed me
year was
what's that?
what year was this? Just to have some reference in time.
This had to have been, it was early 2000s, maybe like 2004, 2005. I was out of dental school. I just started practicing.
It was like really early on, like right when it
Yeah,
started.
it was really early on. And so I bought this book, for Million Dollar Lips. I think you know something about this book. And and then that was really what got me interested. I thought that it was very interesting that this was something that was available to us. And then from there, I found a class. There was a class that came to Indianapolis. I took that class. That was the first class that I took. And then I was kind of hooked. I just thought that it was really cool that this was something that, we have the credentials to do, we have the ability to do, we have the training, the background science training to do. And then it just took off. And then a few things, working in the Virgin Islands, one of my friends, Dr. Dewan Jones, invited me to help him in his practice in St. Croix and St. Thomas. And then there I was the only person, not just dentist, but the only person injecting botulinum toxin and Botox. And so it grew fast, and I was able to get better with it. So that was really kind of what drew me in, and it's fun. It's something that I like doing.
Isn't it exciting that after so many years, I think it was you that told me we have officially 88 codes
Yeah,
for
D 9913 for Botox and 9914 for fillers.
we've
So I
been
mean that's just a sign that pretty soon it will be an option probably for some insurance companies or insurance plans that cover anything as long as you have a code to bill. Then this was something that you can bill out.
actually, I was glad to see that was actually one of the things that came up a lot in when I first started the courses in 2006, all the way through, I would say 2015, it was like still very difficult for them to get insured. There was very few that would allow it. You had to get a supplemental policy somewhere else. And then
Mhm.
and then along the way in the last 10 years, more so in the last 5 to 6 years, nobody says anything anymore about
Yeah,
insurance.
yeah, yeah.
And it's been because, now it's like all of them recognize it and they allow you to bring it in. And the interesting part is like before it was only like half of the dental malpractice would allow you to, and then they started noticing that dentists, and I'm sorry, I'm the culprit of this, but I would be like, well, tell them if they don't insure you, you're going to drop them because you want to go to one that can offer it. How many times did I say that line? So
What
eventually
was the one we were all getting? Lords of London or something like that, or
London. So I still in our program recommend that, but more so for like a dentist that's taking it beyond Botox and fillers. Like he's trying to bring in
okay,
device and do like a full
threads
on,
and stuff like that. Yeah,
then you probably want to get a separate carrier. But for just doing the injectables, it's so, as you know, it's so it should be
right.
part of what you're doing, and it's easy to add that in. So yeah, it's wonderful to see codes now. It's wonderful to see. It's an excellent time to really get into it because you're not getting any resistance like before,
Right.
So that's why we're kind of expanding into these because, we've been in all the major markets for 15 plus years, but we're starting to serve more by doing these hybrid programs and going out to places like Dallas and DC and doing more so that there's more opportunity for people because until now, all of our DC people were coming to either Miami or New York,
Yeah,
all the
yeah.
cities to go to. So I'm excited. I personally love DC. So I'm excited to be there with you and Dr. Misha. It's going to be an incredible program. But tell us a little bit about this venture into the Caribbean. How did that get going? I know that's everybody wants to hear that because it's like you go from Indianapolis and then
Not
now
many
you're
people.
in
That's
Island.
true. Well, it started where when I graduated from dental school and moved back to Indianapolis. At the time, the exam for the board exam was given twice a year, and I did a residency program at the MCV at Virginia Commonwealth University. And so when I came back, the exam had already passed, so I had to wait until October. So I took a year, well, it was maybe about 7, 8 months or so, just to kind of, relax, do what I wanted to do. And I went to St. Thomas to visit Dr. Jones, and he suggested that I get a license there. At the time, the Virgin Islands had their own exam as well. And so I
Okay.
thought, why not? I don't have anything else to do. So I got the exam. I did the exam, passed, and got my license there. But then I started working in Indiana. At the time, Dr. Jones, his practice was growing fast, and he needed a dentist. And so I thought about going, but then I thought, no, that's too much, trying to fly back and forth and stuff. And Dr. Latier started working, and I saw him posting all this stuff online. He was having a ball. He was, enjoying himself. And I thought, I need to be down there doing this, with my friends. And so then I started to go back. And it was part helping him out, but then also it was a great getaway when it's cold here in Indianapolis. I can go there and still get the, my vitamin D and everything, and it worked out well. So, things kind of worked out so much that I started working working with other doctors there, and bought a place. And so now I'm kind of part, island back and forth. So I have associates that help me in my practice at home for when I'm gone, and it's become part of my life. I enjoy it. It's great.
How long has it been now that you're doing this back and forth?
It's has to be close to 10 years now. Like I don't know. It's been a while, yeah.
Wow, because when I first met you, it was like the start of it or something like that, you know.
Right. Yeah. I always
Uh,
have to think like it was maybe 2 years before the hurricanes. So I've been through that. Irma and Maria, which was 2018.
yep,
I- Yeah. So yeah, so it was like I started a few years before that.
yep.
Hmm.
Oh, how would you say facial injectable treatments, cosmetic and dental therapeutic, how would you say it's changed the way that you serve your patients?
Well, it definitely gives me more options than I had before, especially in treating temporomandibular disorders. Uh, Also, I think that it helps with marketing. As you were talking about marketing, I'm a marketing major, and um, being able to say, for example, if you need patients, fortunately, I've, both of the offices where I've been working, marketing is not really something, or rather acquiring new patients isn't something that we focus on so much. But at times when we want to see more patients, that it's like one of the best things. Whenever you have someone coming for something that they want to do, then it's easier to bring them in. I mean, you can't really advertise root canals, I mean, you can, but no one wants to. I want a root canal today. No, it doesn't happen like that. So it's giving me more options. It's also giving me a way to think about things a little bit differently with aesthetics instead of just whitening and veneers and things like that. I can offer patients other things, and I enjoyed the conversations that I have with patients. Um, and the other thing is, for example, things like the IAFA conference in November, being able to talk to and have colleagues that are physicians, plastic surgeons, nurses, PAs, that has really been good. I know that a lot of the people that I know, I would not know if it weren't for the fact that I was involved with this, that I understand that we can talk about these things together. And going to the conference, there's tons of people that I'm really close to that I wouldn't know otherwise. So, even if you think about it as a social thing, you can expand your profession just by learning a lot about, aesthetics as well.
I'm glad you mentioned that. What Dr. Cabbell is sharing here is the International Academy of Facial Aesthetics, which has become, since 2011, has been the supporting academy for DentaSpa. And essentially, what's exciting about this academy, as you know, there's many aesthetic conferences around the country, around the world, but we started this in 2011 as a way to support dentists that were graduating from DentaSpa. So from 2011 through 2015, 2016, when I met Dr. Cabbell, it was pretty much like 99%, dentists attending. And then on the stage was different from PAs, nurse practitioners, dentists, plastic surgeons, derms, talking to this audience of dentists that were in this field. And whether you're beginning your journey or you were really already into it, it was just a great meeting that, you can get at the innovation, do workshops, et cetera. But then when I met you is the turning point. In 2016 is when I realized, okay, DentaSpa is curated for dentists, but let's keep growing this academy into a multi-specialty, because the beauty, there was so much resistance from plastics and germs to pretty much anybody, any MD that was not a plastic or germ getting into it, but also a dentist who presented probably one of the biggest threats, because you guys are in the face. There's so many competitive advantages of a dentist doing this. So when in the beginning there was a lot of resistance, and then all of a sudden I said, I have to do this, and I have to make this more multi-specialty. And now it's kind of like 60-40, and it keeps growing. We have more medical professionals. We have in 2016 we started Dr. Kian Karimi, we have Dr. Shino Bay, we have all these incredible, Stacey Shimento, incredible practitioners in the medical realm who teach at a lot of these aesthetic conferences for medical.
Yeah.
But the beauty is in at our meeting, we always have like 1 to 2 dentists on stage. And so that was the beauty of having all of them play in the same sandbox, right?
Yeah.
What I loved was just a few years later, and Dr. Kian Karimi tells me, you're the reason why I decided to do the LAMCA, which is an amazing meeting that happens every March in Beverly Hills. But what I love that he did is that he also made it, he made the same thing and brought on like Dr. Rifkin, who's one of our faculty. He's one of our faculty at IFA. And he's on stage, different top dentists. And so he continued opening what I had done. And I saw that, and I thought it was so beautiful. And now more aesthetic conferences are realizing you can't see the full picture without allowing all specialty backgrounds to come together. It doesn't matter that they can all do Botox and fillers, but they all come from a different background, right? So
that is true.
Like the head and neck, the dentist, the nurse, everybody has their own, background to bring into it, whether it's their experience, their education. And so seeing this now today and seeing how much more it's been integrated and accepted is very exciting, because was not like that in 2006.
Right. And that kind of piggybacked on one of the things that you said earlier, in the fact that it's been changing. It started in the beginning where there was a little bit of resistance for dentists doing things, to the point where more dentists wanted to do it, and then dentists started accepting it, and other people started accepting dentists. When I did early on a training with Julie Horn, and at her training, there was another dentist from the UK. So this is something in the whole world. Now it's very common for dentists to be injecting Botox and doing lips and things like that. But I remember the first conference that I went to, that was in Las Vegas, and I just remember seeing Dr. Terry Alford, and I was blown away. I mean, I think that was another thing that really inspired me to want to do more. I was seeing all these treatments that he was doing with lasers. At that point, I had never even thought about working with lasers. Now I have 3. And so this is another thing. Like, whether you're doing it just with dentistry, or you're doing it for just cosmetic, or you're blending it together, it's part of the profession. And I know that I didn't learn anything about lasers. If we learned lasers in University of Maryland, I missed that day or something. I don't know. But now it's a big part of my practice. I enjoy working with it, doing things not just aesthetic wise, but things that can help me with either photobiomodulation or soft tissue surgery, hard tissue surgery. So you're right about that. That a lot of these conferences now, you're starting to see, dentists that are prominent and that have a lot of influence on the aesthetics in general and the whole profession.
Yeah, and that's exciting. That was Camp Karimi actually in 2016. When part of the conversation of like, I have to start a meeting came from the fact that at the time, in order to do a good cadaver lab in 2016, most of the time practitioners in medicine were having to travel to Europe.
Hmm.
There wasn't really good ones in the US. And so when he knew going into the meeting that it was primarily attended by dentists. And we had already started a cadaver lab in
Hmm.
2011 with Terry Alford and the team. So when he stepped into what we have already curated, now it's even better. But from 2011 to 2016, he steps into this like full on cadaver lab. And he was like, I'm floored. He's like, I
Yeah,
cannot
yeah.
believe this
This,
is.
you, this
But
is the dentists are doing more than we are, right?
this is a non-surgical aesthetic conference, and you guys are doing cadaver labs, and like I can't get one. Like, no, I'm starting one. And so that's the beauty is that in March, for anybody that doesn't make our meeting, Kian Karimi has an incredible meeting in March where he does do cadaver labs. So that's and of course things have followed and there's been more that have opened up, but you know, it really was some of the first ones here that
Pioneers, yeah.
yeah, so that's exciting. You brought up something in terms of the marketing and how much easier it makes marketing, the practice, and just in general other things.
Mhm.
I want to touch on something that a lot of dentists say to me that means a lot to them, aside from, you know, the fact that you can make more money and the fact there's a lot of obviously benefits to doing the injectables in the practice. But one thing that stands out to me that I hear a lot is it changed the energy of the practice in the way that patients treat me. Like, you know, like they
Mhm.
just you know, that you guys do far more intensive surgical difficulty levels of things in the practice, but then you stick a few Botox and you're like their hero and
Yeah, yeah.
and they want to come to you and they're your fan and they want to talk to you and they want to be your friend. So tell me a little bit about that. How is your experience in with that?
Well, I think whenever you can make or help someone to feel better, and we do this with dentistry all the time, number one, but if you can help someone to feel better and then to look better and in a way that, maybe they didn't think about before. And then if you have the knowledge, when you're explaining to them, this is why I'm doing that, you're making the marks on the face and stuff like that, then they are looking at you like, you're an expert. The dentist that I went to before didn't know how to do this, so you
Yeah.
become the special dentist in the area because you know how to do these things that they didn't, their childhood dentist obviously didn't talk about, didn't know, or anything like that. And then they know that you kind of have an eye for things. You have an eye for aesthetics. You have an eye, or at least you're looking at things in the future, when you talk about, hey, I have this device. Do you want to try this because it does XYZ or something like that? So it really help my practice to get to the level where at least my patients feel and know that we're really trying to do cutting edge things, that we're trying to be the best dental office, not just because we say it is, or because we're doing this many numbers, or we're located in this area, but they're like, okay, I know Dr. Cabbell, he knows his stuff, he's talking about some stuff, I'm having this type of pain, and no one else told me that Botox helps with this or something like that. So yeah, that in itself, the patients that are already coming, and then the external marketing when we're, talking, hey, we can do Botox, this and that. And some people may be surprised that it's a dental office, but then you have them in the door. And once they're in the door, and they may only come in for Botox, or they tell their friends about it, and then it leads into something else. So it has been great just to give your practice those, that extra shine. Whether you can obviously, have marble floors and do all that kind of stuff, and it makes the office physically look nice. But the things that you know how to do, the expertise that you have, and special services, and I consider these, even though there's something that I feel like all dentists should be doing, but it is a special service. It's a special, service that I can offer to all of the patients, not just a select few people that feel like, they want to cover some lines or wrinkles or something like that. I mean, everyone can benefit from it. So it's great.
Absolutely. And like you said, just recently you were teaching for us in New York and you mentioned something about, you know, this isn't just trying to look better. This has a lot to do with how you feel
It
and
does, yeah.
acts. And so share a little bit about that. I think that's important for people from the pain
Well,
perspective, from the how you feel perspective, the psychology of it.
Yes, and this is not just placebo effect kind of thing, but without going too far into teaching, when you relax the muscles that make you look angry, then you can't look angry. And so if you don't look angry, people don't perceive you as angry. You don't feel angry. So you're not getting that negative feedback from other people. When you look in the mirror and you like the way that you look, it makes you feel better as well. So psychologically, it can affect your mental state as well. So there's lots of studies on this. It's been proven. It's true. And it's no different. It's no different than, a person feels better when they, get a haircut, or feels better when they put on makeup. And so imagine if your muscles are looking good, and it's natural, if it's a natural type of thing where you're not trying, you're not, doing all the extra to try to, make yourself look a certain way, but you will feel better. And so, yeah, it's a feedback type of thing. And, I think for that reason, it's another reason why it's so popular today.
Yeah, I mean, one of the latest ones that this woman I remember saying to me, she was a model patient, and she had very deep lines here and very like pronounced downturned corners. She was like in tears, and she like texted me. She's like, I finally have my grandson who doesn't call me the mean lady. And she was never mean to him,
Uh-huh.
but he perceives mean. He sees this always, because that was just her animation, and it was
Uh-huh.
strong. And he's like, she's like, now he doesn't call me mean, like, you're so mean. Like, he always referred to
Yeah.
her as. So a lot of, like you said, it's what you're not intending to project that, but it's just as we age, like our
Yeah,
muscles.
yeah. It's literally written all over your face, and you can't do anything. Well, you can do something about it. And
Exactly.
the bad thing is that a lot of people don't know, a lot of people don't know because, you wake up every day and look in the mirror, and that's the way, you think that you are all the time. But with relaxing a few of these lines and wrinkles and things like that, it can make a tremendous difference in your life.
Absolutely. Tell me what's been, I feel like all of our faculty members at some point or another have given me this amazing case, whether it's like just a Bell's palsy, or some sort of accident that happened, and getting some symmetry. There's been just beautiful cases. And so I want you to kind of tell me, in your journey in doing Botox or fillers, whatever it might be, what has been the most rewarding case that you have done, or one of the most rewarding cases that you've done that you really felt you helped somebody out?
I mean, I guess there's a few that come to mind. I will say, just in general, um, whenever it's the first time for someone, those are always really rewarding because, the most people are skeptical in the beginning. They don't really know how it's going to work or anything like that. So anytime I have someone and it's their first time, I probably take maybe 2 or 3 extra steps to make sure it works out, because this is going to be a big deal. But I had a case with a young patient. And when I say young, she was probably maybe like 12, 13 years old. And this was actually still in the early days of me starting to do Botox injections. And she has like a type of palsy where she doesn't have movement on one side of her face. And her mom actually asked, well, also, patient, we have a great relationship. I've known her since she was little, little. Now she's driving. And her mom asked, she said, we've been going to neurologists and physical therapists and things like this, and nothing is helping. She's had surgeries. And, I just don't want her to get into high school and have, where her face, her smile doesn't look the way, we want it to. We know, but, kids are mean. So she says, Dr. Cabbell, I heard that Botox could help with this. Now, this is why the education is so important, because if she had just said this to me, and one, if I didn't know anything about it, I wouldn't have had a solution. But then I kind of understood what would have to happen. We would have to treat the side that wasn't affected to balance things out. And so at first I said, I don't know. I don't know about this. You know, she's young. I don't know about, number one, treating someone so young, but then also, how is this going to be where we're taking away some of her expression? So she said, her mom, I'd really like for you to try. I trust you. You know, you've been our dentist forever. Can we try it? And so we did it. And so the youngest patient I've had to date, obviously, and it worked out so well. I mean, it surprised me because it was the first time I had seen anything like that. And, part of the things that you wouldn't expect, for example, like when someone smiles, that, we have symmetry. You have the same muscles, the risorius, zygomaticus major muscle, that pull on one side, that pull on the other side. So if one side is not pulling, it will make your smile uneven or crooked. So we balanced it out. And this was probably one of the more difficult ones because I was injecting muscles that I typically don't inject for aesthetic treatment, but we were able to get a really nice effect. And she came back for treatment, on a regular basis. I haven't seen her in a while, and I'm not sure if it's just for the fact that what has happened is, her muscles are starting to balance out, or maybe the condition is getting better. But and when I say it's been a while, maybe it's been a year, which is a little bit different than, typical patients that we're seeing every 3 or 4 months. But that was one of the more rewarding, maybe because it was different, or maybe because you really could see that you were helping somebody. I mean, I know it's cliche to say, you're a dentist and you want to help people. We do. We actually really do want to help you. And with Botox, although it is part marketing and business and aesthetics and stuff like that, all of it is helping people. You're helping people to feel better, to look better. You're giving something, like I said in the beginning, that people want. So it's great. And with all the therapeutic too, whether it's, the pain that you're dealing with, it is a great thing just doing all of it. I think, kind of to cap it on that note, I think that's another thing that I really like about the aesthetic treatments, and that there's never a situation where I really feel, bad, or that I feel like I've hurt someone. And I know people think that dentists are a little sadistic, and that, we want to stick you with a needle and pull out your teeth and this and that we get some kind of excitement, or, feel excitement or joy from that. I can promise you that nobody does. Well, if someone does, then yeah, they're crazy. But you do feel good about helping someone. And with all these treatments, people feel good about it. And I think that's probably the best thing about doing these type of treatments.
That's absolutely true. Well, we'll definitely share with the audience the before and after. I think I've seen it once before. I don't know if there's been a couple of cases with Bell's palsy, right? More than two. A few faculty have been able to help with that, different types, dealing more with the upper face, etc. But we'll definitely share it here with the audience. And we are just so excited to come to DC. If you have some words to share about what some of the audience that might be listening, what can they expect from the experience if they come out to a program, and just in general with, the experience with integrating injectables like into their practice?
Well, what I can tell everyone is that come with an open mind. Come with an open mind to learn, open mind to experience something new. This is a completely different thing when you are injecting outside of the oral cavity and around the oral cavity and outside the oral cavity. It's a new experience, so that's different. And then also come and expect to enter into a completely new part of the profession that you're already a part of. It's an overlapping profession, like I said, with other medical professionals. But once you take that class, you've walked through the door of, now you're an injector. Like, this is the term that, high school kids are saying now, I want to be an injector. But you'll have something, and then you'll learn from the first day something that you can take back to your practice and do. You don't have to buy a new device. You don't have to take an additional training on top of what we've already done in order to start. you're licensed and you can do it. You don't have to apply for another license in your state or anything like that. Maybe in Georgia, I'm not sure if you have to apply for that license, but in most states, once you take the class, you can.
Yeah, so to clarify, every state is different. I will say that DentaSpa and very few others are nationally recognized by AGD, and then even fewer academies in the US are nationally recognized by the ADA. We are both. And then in addition to those national recognitions, we also have made sure that any state that has additional requirements to register programs that are approved within their states, we also are with that. So like Georgia, Nevada, New Jersey, et cetera. There's only a few that have that extra state thing, and we also have that. So, we're on it. We're here 15 years plus now, and so excited to visit DC. We're going to have a great time. So hopefully you in the audience will be with us. Thank you so much, Dr. Shawn, for taking time.
Inviting all of my friends and my friend, Dr. Michael Wright, that with Dentarage, that teaches implants. He's in Bethesda, Maryland. All of my colleagues that I went to school with, I'm inviting everyone to come out, whether you've taken a Botox class before or you want to learn a little bit more. I mean, the profession and the Botox part changes. So every year there's something new. So even if you've taken a class before, this is a great refresher. So I'm looking forward to everyone coming out and learning and having a good time with this.
I'm actually so excited that you just said that. If you are in the audience and you've already attended and feel comfortable with level 1, we've opened up our hybrid program. So you can come you can come to the July 26th program and either do the D4 lip program, or you can come and do sorry, not July. We're in August. The program in DC is in August. And it's a 2-day program for D1, but the second day, on that Sunday, we actually are going to open it up so that you can take self-paced online lectures for the level 2, which is facial sculpting and lower face Botox, or the D4, which is our lip and perioral program. And so either one or both, you can actually take those programs and come just to that to the Sunday part of that 2-day D1 program, level 1 program, and get advanced program. So any of you out there, if you're like, oh, I already know the basics, well, come on out and learn the advanced stuff, because that's really where you're going to make a difference and really be a top injector, because it takes practice. Yeah.
All right.
Thank you so much again.
Hey, thank you for having me.
See you soon.
See you in a few. Bye.